I want to go over with you today a case study of an individual who's engaging in severe eating disorder behaviors, but not losing weight. And I'm pointing that out because what it's doing to this individual is making her feel invalid in her eating disorder. She doesn't feel like she's doing her eating disorder well enough and therefore doesn't deserve treatment. Now, of course, that's not true, but that's a very common thing that eating disorder voice can tell individuals battling an eating disorder, is that you're not sick enough, or you're not at a low enough weight, or you're not doing this well enough, because if you were, you'd be seeing fill in the blank, right? It's a very common mantra that we hear. Basically, what I say sometimes is it's the eating disorder's way of convincing you that you're gonna be fine and you don't need help, but that's not true. Now, real quick backstory on this particular person before we go into the metabolic test and body composition. This person is 5'1". She's been battling an eating disorder for a little over 20 years. There have been periods of recovery, but then she's relapsed. She has been in treatment a few times, and most recently, before coming in to see us, had been in a treatment facility and then stepped down to see me as an outpatient dietitian. The issue here is that what tends to happen is this person will step down from their treatment facility, go to a dietitian, and then start to spiral pretty quickly because that eating disorder gets really, really strong. So I want to tell you that, and then I'll tell you more about her behaviors and specifically what she's doing in a minute. But let's take a look at that metabolic test of the first visit seeing me. So remember, this person had come from a treatment facility, so that's why I think this metabolic test actually looks pretty good. You can see here that that protein substrate is only 2% above normal, so the body's not breaking down way too much of that muscle mass, but her metabolic rate looks pretty good. We would expect her resting metabolic rate to be at about 1,300. Hers was at 1,413, which is great. That means the body has actually recovered and restored that metabolism, again, likely from the work that she did in her treatment facility before. Now, what's important to note about this, just as a reminder, this 1413 is how many calories her body needs completely at rest. We're not going to feed her 1,413 calories. We're going to feed her well above that. This is just saying that her resting metabolic rate is good. Now, what's interesting about this case is that prior to going into treatment, this person had been at a much lower weight and has now restored some of this weight. So again, I think that's a big reason why her metabolic test looks good. But I really wanted to show you this because I think it'll help make sense of the body composition that I'll show you in just a second. Okay, so here is the body composition analysis. Now, this is obviously over a few months. The metabolic test that I just showed you was from June of 2020. This person had stepped down from treatment, came to me in June of 2020. That's when we did the metabolic test. And then this is her body composition over the subsequent few months. Now, right when she stepped down from treatment, this person was not engaging in any behavior. She was trying to meet 100% of the meal plan that her treatment facility had set up, but she really wasn't able to do that. For a few weeks after treatment, she was getting to like 90% of the meal plan. So her caloric intake was probably about 1,800 calories per day, which was, again, not what the treatment facility had recommended. They had recommended a little bit higher. So she was able to do that for a little bit, but then it slowly started to slip. Now, historically, this person has engaged in severe restriction, keeping calories really, really, really low, over exercising for 2-3+ hours every single day. She's engaged in purging, diet pill abuse, laxative abuse, many different behaviors to try to manage her weight, right? And so what was happening is slowly creeping into July, toward the end of July here, what we were seeing is she was starting to get back to exercise. Now, she really was saying that she wanted to do it because she was tired of just sitting around and not being allowed to exercise, because previously that had been the restriction from treatment. But what happened is she gave that eating disorder an inch and it took a mile. It very quickly progressed to over exercise, and she started doing, again, about 2 hours a day with only eating about 1,800 calories, which was not 100% of her meal plan. So that was one behavior that slowly started to creep in. And then what I noticed on her food logs is that food started to slowly drop. It would go from having 3 meals and maybe 1 or 2 snacks to having no snacks. And then a meal started to slip off. And by about October, we were at not even 50% of her original meal plan. So calories were at about 1,000, if not a little bit less than that. And the exercise was still happening. Now, what I didn't know until more like November is that she had also started taking diet pills again and started taking laxatives again. So falling back into a lot of those behaviors. By December of 2020, we had all of the data of what was going on. She was back to exercising 2+ hours, not every day this time, but like 5 to 6 days a week. She was taking multiple diet pills and laxatives per day. Her caloric intake was down to about 500 calories per day. And she was just overall not working towards improving any of that because that eating disorder got so loud. So, what are we seeing here with her body composition with all of those behaviors? Of course, we saw weight go up. We saw lean mass drop and we saw fat mass go up. Now, this is the part where people are like, wait, that doesn't make any sense. That's impossible. Everything that you just said, she should be losing weight. But here's where the body is so resilient. Now, this person has been dealing with an eating disorder, like I said, for over 20 years. And I can't say this for sure, but when I see individuals that have chronic eating disorders like this, it's not uncommon that their body learns to adapt in this way. So her weight is going up a little bit, sort of started to plateau. And what she's thinking, or her eating disorder is thinking, is that she needs to engage even more in more behaviors. And so it's a huge battle. I wanted to point this out though, because all of those behaviors are so much more important than where her weight currently is. She deserves treatment because of everything that she's engaging in. When it comes to needing or wanting to seek treatment for your eating disorder, there's no rule that you have to be or look or be using certain behaviors in order to get in a certain way, right? What it comes down to is how much is that eating disorder impacting your life? Are you obsessing over everything that you're eating? Are you abusing diet pills and laxatives like this case study is? Are you doing other things that your sole focus is on weight, shape, food, body image, all of those things? If it's taking over your life and taking over your thoughts, you deserve treatment no matter what your metabolic test or body composition, or even if you don't have that data, looks like. You deserve it. Guys, don't forget to like and subscribe. We're so glad that you're here.